Nurse Blake here, and in this show, we are going to talk about all things nursing school. So if you have any questions about nursing school, make sure you drop them down in the comments below. I went to nursing school in Orlando, Florida. I started my prereqs in 2010, started officially nursing school in 2012, and I graduated in 2014. So I've kind of been out of the nursing school game for 4 years, but that's okay because I have future nursing student Daniella here with us. What's up, Daniella? It's so good to see
Hi,
you.
Blake. It's good to see you too. How
Thank
are
you so
you?
much for joining. I'm good. I'm good. Those of you people who don't know, I went to school with Daniella's mom, Emmy. We were in the same program
Yes.
together, graduated together. And then you kind of followed in behind us and
Yes.
you started nursing school, right?
Yes, I did.
And what year did you start?
I actually started spring 2018, 2017. Sorry.
Spring 20, and you're done. You graduated.
I graduated 2 weeks ago. I'm all done.
That is so exciting. I know we've been trying to get you on the show to talk about nursing school, but you're like, I'm too busy celebrating right now.
Yes. Been busy celebrating, working, and preparing myself for the big monster, the NCLEX.
NCLEX is coming up. When do you
Yes.
take it?
Well, I'm not sure yet. I'm still waiting for my school to send everything out to the State Board of Nursing, and then once
Okay.
that's finished, then I'll get my date started.
That's so exciting. Well,
I'm hoping by the
congratulations.
end of next month, hopefully. So,
Okay, cool. You got to start preparing. You got to start doing practice questions. Are you
yes,
doing that?
yes, I am. I actually
Good.
did a few today.
Good, perfect. Well, those of you tuning in, I have nursing student Daniella here. She's a recent graduate about to sit for her NCLEX in a little bit, and I want to talk about all things nursing school. So if you guys have any questions about nursing school, drop them in the comments below and we will answer them live for you. But also let us know, are you a nursing student? What semester are you in? If you're going to start nursing school, let us know when you start. So just to review, when did you start nursing school again?
Spring 2017.
And it's 2018. You
Yeah.
did like an accelerated program?
No, it's 5 semesters in
Okay.
total. It's an ADN program, so I didn't
Okay.
go straight into like a BSN program, but I am starting my BSN courses this fall. So
Okay.
that's a pretty cool thing. So I'm not taking any breaks. I'm going straight into my BSN and get it over with. And that's the easy part because it's all online. It's just a
Right.
bunch of busy work. So
Yeah, a
the
lot
hard
of
part's
people
done.
ask me, should I do ADN or BSN? If you're in a city that doesn't offer, maybe the BSN is on a waiting list, but you can get into an ADN program, do that because you could
Yes.
just do your BSN online and go straight into it.
Yes. And it's a
Yes.
lot cheaper that way. The reason why I chose my route is because it's a lot cheaper. So,
Okay.
and I didn't want to take loans out or anything like that. So that's my main goal, like to graduate with my nursing degree with no loans. And I did it.
School's expensive.
Yeah, it's
It
very
is
expensive.
expensive. I have a question coming in from Sarah. Did you stress out? She's starting next week.
I didn't know what anxiety was until I started nursing school.
I hear that.
I
I
did
know.
stress, but it's all about how you think. You just have to control the way you think. If you control the way you think, then you will get positive results. Just
Yeah.
think positive, and you will get positive results. And just stick to a plan.
I can second that. And we will get into nursing school tips in a little bit. But tell us why you started nursing.
I started nursing because there were so many opportunities, and I've always wanted to do something where I'm helping others and doing something that I know that I would be proud of and God would be proud of also. So then my mom, she's also a nurse. She became a nurse while I was in my freshman year of college, while I was taking my prerequisites. That's when she graduated from nursing school.
Okay.
And she would always tell me, like, hey, why don't you do nursing? And at first, I didn't know what nursing was in high school. When I was like 17 years old, my junior in high school, I promised I did not want to be a nurse. I was like, I don't know if I'm okay with being a nurse. But then I did my research on what a nurse does, because
Hmm.
nursing is not just wiping butts, it's more to that.
Right.
So I did my research and I literally ever since then, I became extremely passionate, and I was like, you know what, this is exactly what I want to do. There's so many options. I found out you can do travel nursing, you can do forensic nursing,
Yes.
you can go to law school after nursing school and become a lawyer who defends nurses. So
Yeah, you can do
there's so
so
many
many
options.
options.
Yeah. So I'm
I
like,
love that.
this is exactly what I want to do. And then originally I wanted to be a psychiatrist. So then I
Okay.
knew like nursing, you can become a psychiatric nursing. So I can
Yep.
always like switch it up. So
Yeah.
yeah.
In nursing, we do it all anyways.
Yes.
Like we help mental health. We are a little bit of pharmacy. We're a little bit of rehab. We're a little bit of everything, which is so cool.
Yes. That's
We
the
I got a question from Jesse. Did you work when you were in school? If so, what is your take with the job and nursing school?
the beginning, my first 2 semesters, I did not work. I thought it was just too much to work with because nursing school is a full time commitment. You won't really have time to work. So I started working my third semester. Luckily, the hospital that hired me, it was a per diem position. So I wasn't working full time or part time. It was just per diem, which is I picked up at least like 3 shifts a month
A
or
month.
2 months.
Yeah.
So it wasn't a lot, but I worked as a CNA. I am not CNA certified, but once you complete your, first semester of nursing school, you get to, work as a tech. So that's what I did. And
Okay.
it was a great opportunity because I was a float nurse tech. So I
Yeah.
floated to different, So I floated to different floors and I learned a lot. And now I know where I want to work and where I don't want to work as a nurse.
I
So,
think it's if you can, not all people want to take a job in nursing
mhm,
school, and that's okay. Some people
mhm,
want to focus 100% nurse school. That's great. I also took a job in nursing school, and I thought it
mhm.
was the best thing for me. I worked as a tech, so much experience. It really, I think, working in the hospital helped me in
Right.
school, and it helped me transition to nursing. So I say if you can, yeah, work per diem, work part time, something that's flexible with your schedule.
And it was a huge opportunity for me to network too.
Oh
So
my gosh,
I'm
yeah,
so
for
happy
sure.
because, I floated to different floors. So it's not like I was a tech on one floor where I saw the same type of patients. I floated to different, floors. So it really helped me a lot to figure out what exactly I wanted to do as a nurse because there's so many options. And I was a
Yeah.
little confused. I feel like every semester I changed what type
What
of
you
nurse I
wanted to
wanted to
do.
be. Like when
Yeah.
I did OB, I was like, okay, I know I don't want to do OB, but I think I want to do NICU. So you change your mind all the time. So working as a tech definitely helped me figure out what type of nurse I want to be.
We're getting another question from
Oh,
Caitlin. She's a second semester, first year student doing the double degree in nursing and midwifery, which is awesome. Loving it. If there is one thing you wish somebody told you as a student, what would it be?
I wish someone would have warned me about my first semester of nursing school.
Okay.
I wish they would have told me that the questions were, different. It's not like anatomy and physiology.
No.
I wish that I would have known not to waste so much time reading on like so much on like the patho and physiology because none of
Mhm.
that was on the exam. It was more so patient safety, patient education, and
Right.
the patient interventions, not learning about the cells. Like that, learning about the cells is cool, but that's not going to be on your exam.
Yeah,
So
I think
that's
you learn in nursing school like what your professors are going to test on and what's
yes,
important. If they're going to give you 30 chapters to read for one exam and you have to decide, am I going to read all this? And for most
yeah,
times in nursing school, you don't have to read all of it.
you
You
don't.
should understand basic concepts and you should understand why things happen, but you don't need to delve into it and read every word,
Yes,
because you're going to have so many different things to study and you're going to have so many exams. You've got to prioritize things.
yes. Oh no.
We got another question from Monica. What's up, Monica? What is the best test bank or question bank to test yourself with practice questions? Did you use
Um,
anything in school to?
Yes, I use Saunders and Reviews and Rationales. Saunders
Okay.
was a really great tool for me, and Lippincott.
Okay.
Those were really good, but you have to read the rationales. You can't just do questions and not do the
Read the
rationale.
rationales.
So
Yeah.
you have to read the rationales.
I second that. I agree. What was your favorite class in nursing school?
My favorite class would be pharmacology. Well, my
Okay.
school is different, but I would say
Dang, a
pharm.
lot of people would be like, she
I,
is crazy.
yeah, I love pharm. That was literally the best part of nursing school. Like meds. I love my meds. Love
So
patient education on my meds.
tell people how to study farm.
With farm, first you have to study it by the classification, and then you study it by the therapeutic effects. So, for example, beta blockers. Okay, so what medications fall under beta blockers, and then what is the therapeutic effect? Like, what does it do? So that's, and then the common side effects. Know your patient education that you would do for for that classification. So learn it by classification, not by each individual medication, because I know my first semester I was like, oh my gosh, like how am I gonna learn all these meds?
Right.
But
There's so many.
yeah, it's so many, but they all do well. Beta blockers, they all do the same thing. It's just different types of beta blockers.
Right. Yeah, I
So
think you have to focus it by class and then narrow it
yes,
down. In farm, don't try to memorize, really try to understand and grasp because sure, memorizing will get you through that test, but everything in nursing is cumulative. And you have to know you have to know things. You can't just memorize them.
yes.
Another question. I'm Matthew. I'm starting prereqs for nursing. Congratulations. Any tips into getting accepted into a nursing program?
Um,
I think we had to take the entrance exam,
yeah.
the T's. So you got to make sure, you score well on that and then keep your GPA up because that's one of the big things they look at.
Yes. And just do your research on the schools. Don't stick to just one school because every school have different requirements. Like I found out that some schools don't even require the T's. And I found that out last
Okay.
minute. I was like, wait, what? So
Yeah.
just do your research. Some schools you just need to take like extra prerequisites and they will like they won't even they don't care for your T's. So which is
Okay.
really completely surprising to me. But so
Yeah.
definitely
And
do
then
your research.
I think also when you're looking at schools, definitely look at costs and look at the NCLEX pass rate. You'll want to make sure they have a high pass rate because that's a good indicator that they're training their students well to transition into nursing.
Yes.
You don't want to go through school and then not be prepared for the NCLEX. Like
Yes.
that's not a good thing. So we talked about your favorite class, pharmacology, which you're crazy. My next question was going to be, what is the most challenging class? Which I thought you were going to say pharmacology, but not the case.
Definitely OB.
Okay.
That
That
was
is a hard class.
it was.
I had
I
OB and peds in a summer semester. It was crazy.
yeah, I struggled in OB. I did not like OB at all. It was challenging because the medical terms were different. I went from med surge to OB to back to med surge, so it's just different. And then it's hard to like a course, especially if you're not interested in being an OB nurse. So
Right.
that was my problem. I was not really interested in OB. So
Yeah. So it's hard. I know. But you still got to know because no matter what unit you're on, you got to be prepared to care
yes,
for a
yes.
pregnant patient. You know what I
Oh
mean?
yeah.
So you got to learn. That's why nursing is so there's so many different things and concepts you have to learn, at least build a foundation on.
Yes.
We're getting a question. Any tips for studying A&P, anatomies and physiology? It could be painful.
Ooh, that was years ago.
I know.
um,
So A&P for us is back in like our prereqs. I used a lot of YouTube. I watched YouTube videos to help me get through that. They do coloring books. I had a coloring book to learn things, but do you
I
have
just
any
used
tips?
my PowerPoints that my
Okay.
professor provided us. Like I didn't
Provided.
even needed the book because her PowerPoints were so good, and it well
Yeah.
prepared us for nursing school.
Okay.
So read the PowerPoint inside and out, and definitely go to tutoring if you need help. Stay behind after class and get extra help from your professors.
Yeah.
They're
Oh,
there to
yeah.
help you.
Always ask for help. You're not only a student, you're also a customer. So you're paying. So if you need help, ask for it. If you're walking through Whole Foods and you want to find the bananas, you got to say, hey, can you help me find the bananas? So you can be
Yes.
successful.
Take full
Um,
advantage of your resources.
Thank you. Yes. Any study tips that you could think of to tell nursing students?
Study tips. Find what's best for you because everyone's going to tell you to do this and do that, but you literally have to just go and test everything out yourself. And whatever works best for you, go with that. What I did was I recorded lecture. We were allowed to record. So I recorded. And when I got home, I would listen to the lecture over and
Okay.
rewrite my notes.
Oh,
And then
I did that too.
yeah, it's hectic. It's not easy. It's frustrating because you have to like pause and then write, pause, listen and write. But it helped me, and hey, I passed. So that's like key. And then practice questions every single day. That is
Every
definitely key
day.
because you can understand the information, you can know it, but you have to apply it, and you won't know if you can apply it if you don't do questions. So question.
Latoya said she's so proud of you, Dee.
Oh,
With
that
some
is my
heart.
nursing
I
classmate.
love that.
Thank
That's so
you.
great. No, those are great study tips. Everyone studies differently. You have to assess after every exam because every professor is different, like how well you did, what worked, what didn't work. Madeline has a question. Describe your average day in the life during the first years of nursing school. What made you successful? And then we kind of already talked about tips. So what's an average day look like for a nursing student?
For me, it was more so I would wake up, get dressed, go to school. If I had class at 1 o'clock, like in the middle of the day, then I would go to school early in the morning and study. Or honestly, there were days where I skipped breakfast, but don't do that. Make sure you eat breakfast, drink plenty of water, stay hydrated, take care of yourself mentally and physically. Go and work out, go to the gym, do that stuff because you
Right. You
have to
got to
take
take
care of
care of
yourself first.
yourself. Yes.
But an average day for me was more so just literally in my room studying literally all day. Depending who I was studying with, I would take breaks and we would go and go out for eat and then go right
So
back
you
into
had study
studying.
group?
Yes, I did.
I
Latoya
love
was
that.
actually she just came
Oh,
in.
Latoya, that's awesome.
Hi.
Well, thank you so much for chatting with everybody. I'm sure they really appreciated it. There's a ton of questions. So if you, Daniela, can just go through the comments and answer
I
them,
will.
that would be awesome. Good luck on your
Thank
NCLEX.
you so
You
much. I'm so
got
nervous.
this. Keep doing, you got
Thank
it.
you.
I mean, I think a lot of people are so nervous about the NCLEX, but I say to prep for the NCLEX, you got to do practice questions every day, never too early to start, and then have confidence in yourself
Yes.
and the skills and knowledge you gain, and try to relax 24 to 48 hours before you go into the exam to tell yourself, I got it. I know this information. I'm going to do well.
Okay. Thank you
And you're going to
so
be
much
just
for
great.
having me, Blake.
Yeah, of course. And tell your mom I said hello. I
I
miss her.
will. I will.
All right. Bye. Thanks so much
Bye.
for watching, everyone.